being here today and devoting your time to join our side event today. My name is Jake Agliata, and I am the Policy and Communications Officer with the International Network of People Who Use Drugs, otherwise known as INPUD. And it's my pleasure to be moderating this side event today, discussing the human rights barriers faced by people who use drugs and why addressing these barriers must be a critical component of the global AIDS response. We have an incredible lineup of speakers who will be presenting over the next hour. And after that, we'll have a 30-minute Q&A session where we hope to answer any questions you have. So a few housekeeping items before we begin the event. First, I want to let everyone here know that the event is being recorded and will be made available to watch online later this week. And I would like to remind everyone to please keep your microphones and cameras off unless you are presenting, just to make everything run a little bit smoother and to avoid any background noise, obviously. And finally, for the Q&A section, please submit questions in the chat room, which you can find on the upper top bar if you are in the Microsoft Teams platform. We will try to get to as many as possible at the end of the event, and we encourage you to submit questions during the event while speakers are speaking so you don't forget them by the end. Now, to kick off the event, I'd like to turn it over to Judy Chang, who is the Executive Director of INPUD, who will be delivering some opening remarks for us.
So welcome everyone to the side event, The Right to Rights. How do we get there for people who use drugs? Organised by the International Network of People Who Use Drugs in partnership with UNODC, HIV/AIDS Section, the International AIDS Society, WHO, UNDP, OHCHR, and UNAIDS. So we know the HIV response is not where it needs to be for key populations, including people who use drugs. When rights violations occur against people who use drugs, rarely is there public outcry. On the contrary, often there is political and public support. People who use drugs the world over face mass incarceration, violence, coercion, stigma, and discrimination. Rights violations against people who use drugs are driven by criminalization and punitive laws and practices. Almost all countries have laws that either criminalize or use to target people who use drugs and sex workers, and too many countries continue to criminalize gay and bisexual men and transgender people. We know that the impact of these laws is not insignificant. In fact, it is immense, increasing HIV transmission and reducing access to services. We also know that the links between criminalization and HIV are clear. It's by no accident that key populations who remain criminalized in many countries now make up 62% of new HIV cases. Systematic reviews have found that criminalization and repressive policing increases the risk of HIV, needle sharing, and avoidance of harm reduction programs. So we may now have a political declaration that may include ambitious targets on the removal of punitive laws and practices, along with measurable targets on community-led responses. These targets can drive and measure change, and they should be used to hold decision makers accountable. So 40 years on from the beginning of when HIV was first detected, we are still far away from righting the political wrongs that we know have held us back. We need to start fully fund what works. We know that is decriminalization of drug use, evidence-based interventions such as harm reduction, and community-led responses. The world cannot afford for governments to selectively pick and choose what they will support based on moral prejudice or political expediency. We need strong global commitments and local action, and we know that this is best done with and by, not for, communities. So just finally, we'd like to thank Robert Carr Fund, the Love Alliance and Global Fund for investing in community-led responses. We absolutely need more allies who are willing to do what's right, not what's convenient. And communities of people who use drugs should be leading the fight for the right to rights of people who use drugs. And we know that this should happen whether it's related to policy change, service delivery, or in shifting public narratives. So I just want to thank everyone for joining today, and sure you will enjoy the great lineup of speakers we have. Thanks.
Thank you so much, Judy, for those opening remarks. So very excited to get to our full speaker lineup. We have a lot of great speakers to get to today. Our first speaker is Fariba Soltani. Fariba is the chief of the UNODC HIV/AIDS section, and we are excited to have her give our first presentation today, discussing human rights barriers faced by people who use drugs in the context of the global HIV response. Fariba, you have the floor whenever you are ready.
Thank you very much. I want to ask if Irina, one of my colleagues, can share the presentation, or is somebody sharing the presentation? Yeah.
I can share. Just a second, please.
Thank you, my dear. Thank you. So I can just start by saying I want to thank INPUD for organizing this session, and for all the efforts that you've put in to get this excellent lineup of presenters. And I'm really happy to be a part of this session and provide you an update, a little back summary of what we are doing at the UNODC HIV/AIDS section with regards to harm reduction in human rights. And as you can imagine, human rights is the core of everything that we do in our section. And I just want to start by saying that we have 2 new strategies adopted this year, which will provide the framework for our work until 2025. And I want to just highlight some elements from these 2 strategies relating to harm reduction and human rights, which are really relevant for this session, and I think will set the scene for all of us. And I really agree with all the issues that Judy has just raised, which are very, very important. And I think it's the essential elements in really making a difference, because as Judy said, we are 40 years into the AIDS epidemic. I have been working myself for the past 20 years on drug use and HIV, and we still, very far behind from where we are supposed to be in reaching the goals and targets that were set in the previous political commitments that was made. So we have to see how to do things differently in order to reach the new commitments that are made under the Global AIDS strategy and the UNODC strategy that, as I said, will be guiding our work for the next 5 years. The Global AIDS strategy, as you know, was adopted in March this year. And as you know, we are the convening agency within the UNAIDS family for HIV prevention, treatment, and care among people who use drugs and people in prisons and other closed settings. So we have been very closely involved in the development of this strategy together with many partners and the great involvement of communities. And we are very pleased to see that many of the elements really respond to the needs of people who use drugs and putting communities at the center, which is very, as I say, it's very, again, close to our hearts, and it's a main element of how we work in the HIV/AIDS section. So, yes, the UNODC strategy was also adopted this year, and it's for the next 5 years. And hopefully it will equip us better to deliver effectively, efficiently, and with accountability, elevating our support to member states to build just, inclusive, and resilient society and to leave no one behind. I also want to highlight that one of the 8 outcomes of the strategy and the part on drugs is addressing the comprehensive, evidence-based, and human rights-based HIV prevention, treatment, and care services for people who use drugs, and of course for people in prison and closed settings. So our work on that we do within UNODC on HIV is very at the center of the UNODC strategy, and there is a lot of emphasis provided on the work that we do. Can you go to the third slide, please? So under the global AIDS strategy, as you can see in the slide, there are 5 identified priority areas for global action focusing on the inequalities lens, HIV combination prevention, 2025 targets and commitments, the needs for resources, which of course is instrumental, and communities, human rights, youth, humanitarian settings, and the COVID pandemic. The 3 strategic priorities of the global AIDS strategy aim to maximize equitable and equal access to comprehensive people-centered HIV services, break down legal and societal barriers to achieving HIV outcomes, and fully resource and sustain HIV responses and integrate them into the system for health, social protection, and humanitarian settings. And what I wanted to actually add, that the implementation of these 2 strategies in synergy, I think, will amplify the impact, because the reach of the strategies are different. Our comparative advantage with not only working with the health sector, of course, with our community partners, but also with the law enforcement sector and with the justice sector, which are very important stakeholders in this discussion and are usually not a part of the discussion, I think will amplify, and hopefully we can reach better results by the end of these 5 years. Can we go to the next slide, please, Irina? So, yes. In this slide, you can see the ambitious targets that have been set out in the new strategy. And as you can see, there are targets that we need to reach. The 90% of people living with HIV receive preventive treatment for HIV and have access to integrated HIV services, that we have 95% of people at risk of HIV have access to combination prevention. These are very, very important because they also include our key population and harm reduction services, which are very much left behind. And as you know, the service coverage is very low. So these are ambitious targets that need strong political support and resources put into them, that we make sure we reach our targets by 2025. And on the other side, you have the things that we want to reduce, which is less than 10% of people living with HIV in key population experience stigma and discrimination, and less than 10% of people living with HIV, women and girls in key population, experience gender-based inequalities and gender-based violence. And of course, less than 10% of countries have punitive laws and policies. So as you see, these ambitious targets are very, very, very important for the work we're doing. And I hope that we can all put our hands together and really ensure that we reach them in the next 5 years. Can I have slide 6, please? As you can see, one of the important elements in the new strategy is community involvement. Here I've got 2 pictures of, as I said, the work that we do within the UNODC HIV section. We do very much in close collaboration, and we really enjoy very much the close involvement of the community of people who use drugs in the work that we do. And here on one side, you see some of the trainings that we had for health professionals together with our civil society actors in Kenya. And on the other side, you see that service delivery and harm reduction supplies by community workers in Vietnam. I also want to stress the fact that how important the work is with our community and our civil society partners, because in 2013, we actually established the UNODC CSO group on drug use and HIV. And this group has been instrumental in the design, development, monitoring, implementation of all the activities, and it has resulted in many, many excellent initiatives and different the guiding documents that we have all managed to do together. And I'm very proud of this collaboration and this group that we have established. Actually last year, we also managed to establish the first ever informal network of civil society organizations responding to the diverse needs of people who live in prison settings. And this is the first time that we have established this group, and we hope that we can reach similar levels of engagement as we have with our drugs and CSO group to really address the needs of this population group as well. Can you go to the next slide, please? As I mentioned, UNODC, we have a close collaboration with law enforcement stakeholders in all our high priority countries as well. And we do promote the removal of legal barriers, discriminatory laws, policies and practices which hinder access to HIV services for people who use drugs and people in prisons. We would really want to strengthen the partnerships between health, criminal justice, law enforcement, prison administration, civil society, and build the capacity for improving universal access and provision of comprehensive HIV services, harm reduction services for people who use drugs, and HIV services for people in prisons. And I think this is very, very important element of our work, and especially in this COVID times, to make sure that services are continuing and that, these punitive laws that sometimes are actually put in place even in times of COVID do not hinder the harm reduction services in the different countries. I would also like to talk about two common positions that the UN has, which actually are also set a framework for the work that we are doing within the HIV/AIDS section. This is the UN Common Position on Drugs, as you see, and the UN Common Position on Drugs was approved by members of the chief executive boards, and it's about sharing a policy for implementation of the international drug control policies through effective interagency collaboration. And the purpose of the common position is to guide the approaches across the United Nations system, stepping up efforts to ensure that no one is left behind, and to inspire the planning and implementation of United Nations activities, including joint interagency activities, and to speak with one voice and raise awareness on the multifaceted nature of the world drug problem. And as I mentioned, these principles are what guides us in our work within the UNODC HIV/AIDS section. And most of the work we do is interagency, and we really enjoy the support of our sister agencies, as well as, of course, as I mentioned, our community and civil society partners. And the UN Common Position on Drug highlights the strong commitments to support member states in developing and implementing responses to the world drug problem within the framework of the 2030 Agenda for Sustainable Development, and the centrality of the UNGAS in commitments to support the practical implementation of the outcomes of the 2016 United Nations General Assembly Special Session, in which was a blueprint for action. So the next UN Common Position, which was actually adopted and launched in May in the CCPCJ, is the UN System Common Position on Incarceration. And this is also very, very important tool for our work, because this actually was led by UNODC together with OHCHR. Zaved, thank you for being a part of this, and the Office for Rule of Law and Security Institution in the Department of Peace and Peace Operations. And again, it constitutes the joint vision of the United Nations for supporting member states to rethink the current over-reliance on and implementation of incarceration. The number of individuals convicted for drug-related offenses is estimated to account for 18% of global prison population, and proportion of women imprisoned for drug-related offenses is even higher than men. 35% for women, 19% for men. And this illustrates the need to address intersecting forms of gender-based discrimination and inequality and abuse, and really using this document to reduce incarceration and offer alternatives instead of and non-custodial measures. So this the United Nations commits to enhancing the advocacy and technical assistance, aiming at shifting policies towards prevention and non-custodial measures, and improving prison conditioning, strengthening prison management, and advancing the rehabilitation and social reintegration of offenders. So as you can see, we have very strong tools. We have our section is very much committed to harm reduction and human rights, and we very much count on the work and the support that we are receiving from our community partners, from our other stakeholders. And I think, as Judy mentioned, it's very important to change the way we look at things. Maybe we need to bring new stakeholders and really reach out to new stakeholders to change the way that these punitive laws are stopping the provision of harm reduction, stopping the provision of evidence-based and human rights-based interventions at country level to really make a difference. And I thank you again for inviting us to this side event. And I stop here because I want to give the floor to all the other excellent speakers. And thank you again, INPUD, for this session. Over to you.
Wonderful. Thanks so much, Fariba, for presenting on those targets and all the ambitious work being done at that level right now. Very much appreciate everything that you just spoke on. Great, thank you all so much. So next we are going to turn to Annie Madden, who is a global peer consultant and a PhD candidate at the University of New South Wales in Sydney, Australia. Annie was a co-author of a peer-led research report recently published by INPUD, assessing the impact of current models of decriminalization from a peer perspective, which she will be discussing today. Annie unfortunately could not be here in person today, but has submitted a video presentation for us, which I will share now. Second.
Hello everyone, my name is Annie Madden. I'm a global peer consultant and I'm also a PhD candidate at the University of New South Wales in Sydney, Australia, with a specific focus on drug user representation in high-level policy settings. I've been involved in the drug users movement for several decades, and part of that involved being a community representative on the Australian government delegation.
We can no longer hear the presentation.
Sorry, the people are having trouble hearing the audio?
Yeah, it was playing for a little bit and then it ended up just cutting out. I think it's because you're muted.
That is probably right.
that INPUD has recently released. I was the lead author on the report, and the report focuses on global decriminalisation reforms, specifically from the perspective of people who use drugs. Now, although this study was actually released and launched at a recent Commission on Narcotic Drugs side event that was co-hosted by INPUD and the Norwegian government and UNAIDS, we thought it was worth re-presenting the report and its findings for this event, and in particular because we're now very much aware of how decriminalisation reforms are really critical to both the health and human rights of people who use drugs, and indeed to promoting the health, dignity and rights of people who use drugs. And this part of that is, of course, removing barriers to accessing services and interventions, and that includes HIV prevention, treatment and care services, with the ultimate goal, of course, of ending AIDS. So that's the context in which I'm here to present this important research and report today. But I'm going to sort of get into the report itself now. So the report, as you can see here, it is called Drug Decriminalisation, Progress or Political Red Herring, ? Assessing the impact of current models of decriminalisation on people who use drugs. So this is the cover of the report. You can see here. Just before I move on to the report itself, I'd like to acknowledge my co-authors on the report. So as the lead author, and then my co-author is Pascal Tangway and Judy Chang, who is, of course, the Executive Director of INPUD. I'd also like to acknowledge the study participants who gave so generously of their time and made this report possible. So a little bit of background on the report itself. So over the past decade, there has been increasing claims that we're moving towards a critical turning point in international drug policy. Many, in fact, are claiming that it's a virtual new dawn in drug policy reform, and often citing recent moves towards decriminalisation by almost 50 countries as evidence for this progress. Despite several recent reviews on the impact and outcomes of various decriminalisation models, however, none have specifically included the perspectives of those most affected by these reforms, and that, of course, is people who use drugs until now. So in this context, INPUD identified the need to conduct a pin-driven research project into the impacts of current approaches to decriminalisation from the perspective of people who use drugs. Now, the aims of our research were twofold, really. First was to bring a critical lens to claims of progress, and secondly is to interrogate concerns that reforms are frequently too narrowly focused on cannabis reform, and or they often simply replace one set of sanctions for another without sufficient attention on issues of injustice, stigma and human rights violations. So to our approach or methodology for our research, basically it was a two-stage approach. So first of all, the stage one was a literature review, and that helped us to identify existing models of decriminalisation, the countries and jurisdictions involved, key aspects of their implementations, and then, of course, to inform the selection of our focal point countries for the stage two of the study. The stage two of the study involved a series of qualitative interviews. We used a purposive sampling approach to ensure balance across different regions, coverage of different models, and of course a diversity of views. We did a total of 8 in-depth qualitative interviews were conducted with 12 separate respondents from countries including Costa Rica, Estonia, Kyrgyzstan, the Netherlands, Norway, Portugal, Uruguay, and Vietnam. The respondents were working at organisations representing people who use drugs, and the majority of people were drug users themselves. We used a framework that we developed from, that was originally developed by Hughes et al. In some research and evaluation they had done for the Irish government. And so we slightly adapted that, but basically that framework allowed us to sort of map some of the key models of decriminalisation that are underutilisation around the globe, and that resulted in sort of 5 key models that we used for reference in our report. If you're interested in those, in the work or the framework of Hughes et al., there's a reference, a specific reference to that work in the INPUD report, so you can see that there and also detail on the 5 models. But in summary, the 5 models that we utilised were depenalisation, de jure and de facto police discretion, decriminalisation with sanctions, decriminalisation with referral to health and social services, and then decriminalisation models that are without sanctions. So they were the models that we focused on. Now, the key areas. So all respondents were asked to provide their views on the impact of decriminalisation on people who use drugs in their context in relation to 6 key areas or topics. Now, those 6 topics were policing, detention and other sanctions, and that also include looking at threshold amounts and administrative sanctions and fines, stigma and discrimination, surveillance and privacy, access to health and social care, meaningful involvement, and then we ask people finally to look at sort of next steps or ways forward. So what did we actually find? So first of all, despite some positive impacts on policing and interactions with people who use drugs, decriminalisation measures have not necessarily or consistently translated into better outcomes for people who use drugs. The models adopted are not full decriminalisation, and this is a really important finding from this study. And therefore, they continue to utilise strategies of control and surveillance and or to pathologise people who use drugs as largely victims in need of treatment. Decriminalisation approaches continue to be based on arbitrary quantity thresholds that do not recognise the reality of drug use or dependence, and this can have extremely negative outcomes for people who use drugs. Countries have replaced criminal penalties with administrative sanctions, and fines are the most commonly used, but these fines are often too high, and when they're combined with poverty and other factors, they can lead to more criminalisation, including charges, arrests and arbitrary detention, and in fact more incarceration rather than less. Whether the punishments imposed on people who use drugs are administrative sanctions or criminal penalties, ultimately we found that there is a need to remove these sanctions completely. We also found that although stigma and discrimination may have decreased in some settings since decriminalisation, once again these outcomes are ultimately being undermined by ill-designed models of decriminalisation. These ill-defined models have given rise to increased monitoring and surveillance, including ongoing use of routine urine drug testing without consent, often to pressure and coerce people who use drugs into decisions and actions. And this was particularly evident when there were things like police quotas or performance measures involved. Decriminalisation laws and policies have contributed to facilitating access to harm reduction services. However, this is not the case everywhere, and in some countries there was no real or lasting improvement in harm reduction or access to other health and social care services. Despite decriminalisation, there are ongoing problems with drug dependency treatment in many countries, including serious concerns about continued force and compulsory treatment in a number of Asian countries. And finally, it was noted that decriminalisation policies are being designed and implemented with little or no consultation with people who use drugs. And even where consultation occurs, Advice is not always taken seriously or listened to, and therefore showing that there is still much to do in the space of meaningful involvement and engagement with people who use drugs. Finally, I just want to look at the 5 key recommendations that INPUD has made as a result of our findings and in this study. The first of those is that all models of decriminalisation must fully decriminalise people who use drugs. That is, removing all administrative sanctions, mechanisms of monitoring and surveillance, coercion and punishment for use and possession of drugs, and of course, ending compulsory treatment. Secondly, that people who use drugs and their community-led organisations must be involved in all stages of the reform process, including the design process and the provision of accessible and credible information to community on any reforms or potential changes. We found that often people who use drugs on the ground weren't even aware that laws had changed or that decriminalisation measures or reforms had been introduced. Thirdly, that full decriminalisation must also include specific strategies to end stigma and discrimination among people who use drugs and to ensure adequate funding for such interventions. Fourth, that full decriminalisation must include scale-up and expansion of access to harm reduction and social care for people who use drugs, which is relevant to the local context and to local needs. And then finally, that once full decriminalisation is adopted, it should only be as a step on a continuum that has as a clear and ultimate goal the full legal regulation of all drugs in a timely manner. So look, that's it from me on the report itself. If you're interested in looking at this report in more detail, you can find the report on the INPUD website. And I really recommend people have a look at the report. It's an excellent report and of great interest to people who are interested in these issues. I'm sorry I can't be there with you today to answer your questions and to hear your comments, but there will be other people from INPUD involved in this event who will be more than happy to do that. And I'm also very happy to take questions and for people to contact me after the event. Thanks very much for your time, and I hope you enjoy the rest of this event.
Wonderful. So hope everyone enjoyed that video by Annie. We really appreciate her being here presenting on the report. And I will put the link to the report in the chat if anyone's interested, and we'll also send it in the post-meeting materials so people can have a read through of that. So our next speaker, who will also be joining us via a video presentation, as he unfortunately cannot be here in person, will be Michelle Kozachkin, who is a special advisor to UNAIDS in Eastern Europe and Central Asia. So Irina, if you could share the video whenever you're ready, we'll hear from Michelle.
Your Excellencies, dear colleagues, and dear participants to this side event. 35 years ago, in the midst of the first wave of a rapidly expanding public health crisis in Europe, I witnessed, as a young physician, the devastation of HIV/AIDS among people who inject drugs in their communities. People infected with HIV through unsafe drug injection represented over 40% of admissions in my hospital ward, where several patients would die every week of untreatable immunodeficiency. There was no harm reduction to prevent infection. There was no treatment for HIV. There was no hope. 40 years later, HIV can be prevented among people who inject drugs. Harm reduction interventions, including provision of clean needle and syringes and opiate agonist treatment, is the proven and recommended standard for HIV prevention among people who use drugs. Antiretroviral treatment has drastically reduced HIV mortality and is broadly available globally. The world is aiming to end HIV and AIDS by 2030. And yet, HIV infections among people who use drugs continue to rise. Access to antiretroviral treatment remains limited, and access to harm reduction services remains unacceptably low. The issue is no more one of lack of available medical interventions. It is now to have people who use drugs effectively access their right to prevention and care. And it is also to transform the international conversation on drugs towards emphasizing safety, rights, health, and development. Current drug policies based on prohibition, criminalization of drugs and drug use, and law enforcement not only have failed on their objective to reduce production, sales, and consumption, but have instead generated a huge international criminal illegal market that fuels insecurity, corruption, and violence. Indiscriminate prohibition-based policies have resulted in daily violations of rights and violations against people who use drugs and mass incarceration across the world. People who use drugs are stigmatized and rejected, live under constant threat of arrest, and are prevented from seeking treatment and support. For 10 years now, the Global Commission on Drug Policy has been advocating, side by side with many of you, for profound drug policy reforms. Place the health and safety of people first, in communities and in places of deprivation of liberty. Decriminalize drug use and possession for personal use. End costly and ineffective incarcerations of people who use drugs, thus ending vast amounts of precious public funds being wasted on harmful and ineffective drug law enforcement efforts instead of proven HIV prevention and treatment strategies. And ultimately, revisit the 60-year-old UN conventions to ending prohibition and move towards legal regulation and legal responsibility over all psychoactive substances and all their uses. One cannot impose health or solve drug-related social problems through a war where vulnerable people are the collateral damage. As a member of the Global Commission, and also a member of the new IAS Lancet Commission on Health and Human Rights, I want to associate myself to the global call of this high-level meeting on HIV/AIDS to end the stigmatizing and discriminating policies and human rights abuses that are the fundamental drivers of the HIV epidemic in 2021. The right to health and decent care, the right to freedom from discrimination, the rights to equality before the law, to privacy, to work and education, the right to benefit in the progress and application of science. These are universal rights. These are also the rights of people who use injectable and non-injectable drugs. We will not win the fight against HIV/AIDS without also winning the fight for these rights. Your Excellencies, dear colleagues,
Sorry, wonderful. So thank you again so much to Michel for that video and for sharing with us. We were very excited to have him participate and give us strong comments on committing to high-level change when it comes to policy reforms for people who use drugs. So thank you for that. Next, we are going to move on to Richard Elliott, who is the Executive Director of the HIV Legal Network in Canada. Richard will be discussing the work of civil society networks working towards decriminalization in Canada and how this work helps achieve human rights protections for people who use drugs, as well as targets in the global HIV response. So Richard, whenever you're ready, you may take it away.
Great. Thank you, Jake, and thanks to INPUD and the co-sponsors for the invitation to be with you today at the side event. If I could ask Irina to put up the slides, that would be great. So I'm going to share with you a case study of civil society advocacy in a country that simultaneously decries the stigma against people who use drugs in international fora and is taking some important and very significant steps domestically to address that stigma and improve access to health services and the right to health of people who use drugs, but at the same time, so far, is unable or unwilling to break free of its addiction to an approach of repression and prohibition fully. So this is a work in progress. If I could have the next slide, please. Based on the available data reported by police forces across Canada in recent years, it is the case that more than 70% of drug-related charges laid in Canada remain charges for the simple possession of drugs. So that is possession of drugs for personal use, not possession for the purpose of trafficking. This shows us how far we have to go in dismantling the impact of prohibition in Canada. There is, however, some cause for cautious optimism. Next slide, please. There is a growing recognition of the need to decriminalize in recent years from many, many quarters, including mainstream human rights organizations, public health authorities, including the chief public health officer of the country. In fact, the Association of Chiefs of Police Forces across the country last year came out with a rather important report in which they recognize explicitly that criminalization is harmful and there is need for transformative change. And this, of course, is consistent with the common position of the UN system that has already been alluded to earlier in the earlier remarks. It is interesting to see as well that there has been some growing support from a number of different orders of government, albeit not yet robust enough action on that front. And there is a shift in public opinion that is happening. Because of this, and because decriminalization is actually increasingly considered a legitimate policy option, next slide, please, it is important for us to actually look at what decriminalization means in practice. And here there is still work to be done. So far, the powers that be, police and prosecutors, generally mean, when they speak of decriminalization, an approach that is not, in fact, full decriminalization. It falls short of what Annie has presented from the INPUD report as being needed, and in fact is instead an approach that focuses on diverting people away from being charged and or prosecuted for at least some drug-related offenses. However, while this is better in theory than the previous situation, it remains the case that it leaves intact in the toolbox for police and prosecutors a tool that should not be in that toolbox to begin with, an unjustified intrusion onto the human rights of people who use drugs, and that hangs over the heads of all people who use drugs and provides a basis for continued police and prosecutorial engagement with people in relation to conduct that should not be the subject of the criminal law to begin with. Next slide, please. So in response to some of the concerns about inadequate decriminalization and what it means, civil society has begun to articulate collectively a different vision, a more robust and ambitious vision of what decriminalization should mean. The concerns about the inadequate notions of decriminalization, which Annie has already alluded to, include the maintenance of an underlying punitive approach that is contrary to the need to destigmatize people who use drugs and continues to undermine their access to health services for those who need and would benefit from health services. It maintains the practice of police interacting with people who use drugs in ways that will still be perceived as coercive, particularly if there are mandates to direct people to health services. Even if those are on paper voluntary, they will often be experienced as coercive. It maintains the continued surveillance, detention, and harassment of people who use drugs under a somewhat less harsh notion that we are helping people. And as we have seen with the application of prohibition to date, at least in our context, it almost certainly will mean the continued disproportionate impact of policing behavior, surveillance, harassment, and so on of those who are most marginalized and on racialized people. Next slide, please. So in civil society's view, if we are going to decriminalize, what is required here, and this is very much on par with what the INPUD report has identified is needed, is the removal of all criminal sanctions and all other penalties or coercive interventions for simple drug possession. And I've put on the slide here a number of examples of things that need to be removed from the current response. It also requires, in our view, an automatic expungement of previous convictions for simple possession to right the historic injustice of criminalizing people for behavior that should not and is not justifiably criminalized. It will also require some clear governance about police behavior to try to mitigate the harm that continues with police interaction with people who use drugs. And it requires removing police as gatekeepers or, quote, liaison between people who use drugs and health services, something that is certainly on the table in some discussions, but will continue to cause problems. Next slide, please. But what about looking beyond just the criminalization of simple possession? And again, this is something that the INPUD report has alluded to. Civil society has identified in a forthcoming common platform that we need to not just fully decriminalize on the demand side, that is possession, we also need to recognize the reality of small-scale sharing and selling, something that if it remains criminalized will continue to disproportionately affect people who use drugs and represents an unwarranted extension of state power vis-a-vis people's behavior. It's the reality that people share substances with friends and acquaintances. Sometimes in order to minimize the risk of police attention in a criminalized environment, people will also purchase for others. And sometimes people engage in subsistence selling of substances. And that remains something that's criminalized as long as we only look at the possession side of the equation. And so the call from civil society will be that we also need to look at decriminalizing the sharing or selling of small quantities, of limited quantities. Next slide, please. Now, it's important to note here, particularly for this audience and in this context, that there is flexibility now increasingly acknowledged within the existing drug control conventions, albeit limited flexibility. First of all, it's important to remember that the stated objective of the drug control conventions is to advance health and welfare. And as has just been underscored by Professor Kozachkin, the current state of prohibition does not achieve this objective. In fact, it undermines the pursuit of that objective. And so it is important that there is now acknowledged flexibility that previously had been denied, that under the existing drug control conventions, states parties have the flexibility to fully decriminalize the possession, purchase, and cultivation of drugs for personal consumption, including under the 1988 convention, which is sometimes still misinterpreted and misrepresented as requiring states to actually impose criminal sanctions for possession in those circumstances. It does not, and it is now acknowledged, and it is consistent with the UN system's common position that our colleague from UNODC mentioned at the beginning, which urges states to decriminalize because they can do so under the conventions, and it makes good sense to do so. I think it's also worth noting that beyond just the demand or possession side, there is also some flexibility within the drug control conventions to move away from the current dominant approach of criminal prohibition. We also need to acknowledge that that flexibility in decriminalizing on the supply side is actually less than it is on the possession or demand side, but it is important for the flexibility that states have under the conventions to be utilized to its fullest in order to adopt a more health-friendly approach, including reducing the burdens and harms of criminalization. Next slide, please. So what might this look like in a particular context? I'm going to give you the example of one country, Canada, as a case study where this advocacy for change is very much underway. And there are effectively two pathways to achieving greater decriminalization. What the focus has been on so far is on decriminalizing simple possession. And the power exists under our domestic law for our federal health minister to exempt people or classes of people from parts of our drug control laws in relation to one or more substances if it is in the public interest. And there is now one demand from one jurisdiction in Canada that has formally been made to our federal health minister, that is from the city of Vancouver, to issue such an exemption to decriminalize within the bounds of that city. We hope there will be other such requests forthcoming in the weeks and months ahead, and work is underway to ensure that that happens. But there are still problems, as I'll come to in a moment, with some of the models that are being considered for this. Just to note that, of course, the more important in the long-term approach that is needed here is to actually change the underlying law. Case-by-case exemptions from the harmful prohibitions in the law are a necessary, immediate stopgap measure, but they don't address the larger systemic problem that legislative change is actually required to address. Whichever approach is taken, there is the important question of ensuring that the details are done right, including specifically the question of the threshold quantities of substances that are decriminalized. And this is something that Annie alluded to from the INPUD report. Next slide, please. And in fact, this is proving to be an issue already in the first exemption request that has been submitted by the city of Vancouver and is raising a number of concerns. There is the potential for thresholds, if they are done correctly, to be quite helpful. They can provide clarity to people who are possessing and using substances. They provide clarity to law enforcement and to society at large, and may reduce the potential for corruption on the part of police. But if they are done right, that means they must be transparent, they must be communicated broadly, and it is important that legally they be defined in ways that have significant legal effect and are meaningful in the real world experience of people who use drugs. So it is very important that any threshold quantities be seen as a floor and not a ceiling, which means that any possession of a substance below the threshold quantity that is allowed is always decriminalized, full stop. And even if you are found in possession of an amount of a drug beyond the threshold quantity, that doesn't automatically lead to charges and prosecutions and convictions. It is always the case that a prosecution must, the burden of proof in a prosecution must remain on those who are seeking to obtain a criminal conviction, including proving intent to sell beyond a quantity that may be allowed. So it's important that those details of thresholds be done correctly. Next slide, please. It is also really important that the quantities themselves be defined properly and that they reflect real world circumstances. And unfortunately, to date, in the exemption request that the city of Vancouver has submitted to our federal government to decriminalize locally, those threshold quantities have been set too low, and civil society advocates have been rightly critical of that insufficiently ambitious request for an exemption. It may well be that at the end of the day, the exemption that we hope will issue will reflect more reasonable and realistic quantities, but that is an ongoing advocacy effort. And I think we can look to the experience in other jurisdictions, and certainly the INPUD report has also highlighted this, that if you set those threshold quantities too low, you are effectively neutering or significantly diminishing the beneficial impact of the entire exercise of decriminalization. So these details really matter. Next slide, please. I think I am at the end here of my presentation. I think there was another remark that I was going to make about the importance of engagement of people who use drugs in this process. And for the Vancouver experience, it is clear that the setting of the threshold quantities that have been put forward by Vancouver in its request for an exemption would have benefited from greater meaningful consultation with people who use drugs, something that the INPUD report has also highlighted. Because in fact, the quantity thresholds were set in the exemption request before the consultation happened with people who use drugs. And in fact, the evidence from people who use drugs was that these thresholds do not reflect real world patterns of use and of possession. So I think that experience is a good case study underscoring some of the key points that the INPUD report has made. And I hope will be taken to heart by other jurisdictions here, but in other countries as there is a move toward decriminalizing, including through mechanisms like exemptions or legislative amendments that set out thresholds. The key message here is that they are important, but they must be done right, otherwise they miss the boat. Let me stop there and I'll pass it back to you, Jake. Thanks.
Wonderful. Brilliant presentation as always, Richard, and thank you so much for being here and for giving your thoughts and speaking. Really, really appreciate everything you're saying. So let's move right along then to our next speaker, who is Ludo Bach. Ludo is the manager of the SDGs and UNAIDS HIV Health and Development Group at the United Nations Development Program, and we'll be discussing the International Guidelines on Human Rights and Drug Policy published by UNDP and the University of Essex. So whenever you're ready, please take it up.
Thank you, and thanks to INPUD and UNODC for the opportunity to discuss the international guidelines on human rights and drug policy. So the guidelines were developed in response to the recommendations of the Global Commission on HIV and the Law, which UNDP convened on behalf of the Joint UN Program on HIV/AIDS. And for those of you that are unfamiliar with the Global Commission, the Commission examined legal and human rights issues through an HIV lens and looked at what's the impact of the law on the HIV response. One of the areas that they looked at was the issue of drug use, and it called basically on countries to ensure an effective, sustainable response to HIV that is consistent with human rights obligations, and asked countries to reform their approach to drug use. I think several other speakers have already noted like the different conventions on narcotic drugs. And if we look at the preamble of the 1961 UN Convention on Narcotic Drugs, it clearly states that the health and welfare of mankind is the main objective of that convention. As we've heard from previous speakers, unfortunately, current drug policies in many countries will not lead to the achievement of that objective. Many countries have attempted to prevent the use of drugs by introducing punitive laws and policies. They have not worked, resulted in mass incarceration. As Michelle Kozachkin said, drug users are continue to remain stigmatized, discriminated, live under the constant threat of arrests. And in many instances, these laws are preventing them from seeking treatment and support. But the international conversation on drug policy is moving away from this prohibition to an approach which emphasizes rights, health, and development. And this is where the international guidelines come in. Also, new research from the O'Neill Institute and UNAIDS, which was released yesterday, once again shows that this leads to better health and development outcomes. The research showed that in countries where drug use is criminalized, the portion of people living with HIV who knew their status and viral suppression rates were 14% lower than in countries with laws that advance non-discrimination, human rights institutions, a proper gender-based violence response, and basically the HIV service indicators there were significantly better. Which is also why the new global AIDS strategy calls for redoubling efforts to scale up comprehensive harm reduction for people who inject drugs in all settings. And in order to do this will require removing punitive laws, policies, and practices, and supporting countries in ensuring that people who use drugs have access to effective HIV and health services, including harm reduction. So the guidelines on human rights and drug policy were developed in partnership between UNDP and the University of Essex, and in close consultation with the Office of the High Commissioner for Human Rights, UNAIDS, and WHO. They're the result of extensive global community and expert consultations, and were launched on the margins of the Commission on Narcotic Drugs meeting in 2019. Funding for the development of the guidelines was provided by GIZ and the Swiss government. So what are the guidelines trying to do? The guidelines aim to help countries in addressing the issue of drugs in line with both the human rights obligations on the one hand and the commitments under the International Drug Control Conventions. So they're a guide for governments to develop human rights compliant drug policies and basically cover the spectrum from cultivation to consumption. They feature recommendations across the administration of justice, looking at discriminatory policing practices, arbitrary arrest and detention, decriminalization of drugs for personal use, and ending the death penalty for drug-related offenses. But beyond moving away from a punitive approach to drugs, the guidelines really make it clear that a human rights approach is critical in improving people's enjoyment of the right to health, to live free from torture, and to an adequate standard of living. So it also has a strong section on ensuring the availability and accessibility of harm reduction services, making sure that these are adequately funded and appropriate for the needs of vulnerable groups and respectful of human dignity. So what happened since the launch? The guidelines have been translated to Spanish, Russian, and Portuguese. We've had 2 regional consultations, one in Latin America and one in Asia Pacific, and we'll have another regional consultation in Eastern Europe this year. And later this year, we will also supplement the guidelines with an extensive commentary to really unpack what is in each of the principles. So it is our hope that these guidelines offer valuable guidance to promote more effective and humane drug policies, as for instance, the examples that was given by Richard just now. So as UNDP, we're committed to our partnership with UNODC, communities, other partners to support member states in developing and implementing human rights-based, development-oriented drug control policies, and really making sure that voice of communities is heard and informs these policies, and making sure that we leave no one behind. Thank you.
Wonderful. Thank you so much for your presentation, Ludo, and great to hear about the international guidelines and how they're being utilized and spread to help member states develop human rights-centered approaches to drug policy. So thank you. Next, we have 3 more speakers remaining. I know we are running short on time, so we will get through everyone and hopefully still have time for a question or 2 at the end. Next, we want to move up to Morgana Daniel, who is a member of parliament from Lithuania and a member of the Unite Parliamentarian Network. She will be speaking to the importance of garnering political will for policy initiatives that address human rights challenges faced by people who use drugs and reaching the social neighbor targets in the global AIDS strategy. So Morgana, whenever you're ready, please take it away.
Thank you so much, Jake, for introducing me. I don't have slides and I don't have a speech written, but I will try to make several points that you might find useful in your further work. Some things were already mentioned by Annie and Richard, but my main message is that decriminalization is key to fighting HIV and ensuring healthcare and protecting human rights. But when you are on the side of parliament or a politician, things look big time differently from what we are used when we work as a civil society. I will now tell you a little bit about the case of Lithuania and then just give my insights in how things work, how changes can be made, I guess, on the political level. So Lithuania had administrative applied code of administrative offenses earlier until the year of 2017. And then we actually made a step towards regressing in our policies. So we started applying criminal code. So it was criminalized actually in 2017. And for the last 3 years, obviously nothing really improved, as we know already from all the data and evidence. So the drug use is still rising, the problems are still there, all of the struggles we have are still there, and we also have a lot of harm. So what really changed is that our law enforcement started targeting young people excessively, and they are so people who are suffering from addiction, who are problem users are under target, and also the young people are really targeted by law enforcement. So the only result, if we can name it like this, is that we, for the last 3 years, we just had around 1,000 or even more than 1,000 cases at court and people sentenced. So that's the only, so to say, result that the policy changed has given to us. And obviously, nothing happened in the field of harm reduction, addiction treatment, healthcare services. No improvement here, and no improvement with HIV situation in Lithuania, neither. So, and then it made me wonder why. But when you are on the political level, you realize that punitive policies are used, sometimes even intentionally, to create this false feeling of safety, as if criminalization itself somehow protects our communities and societies from the harms and risks that are related to drug use. And we know that this is not the case, but on the political level, it's very important, and this messaging has been prevalent for so many years, and it still is there. I think what we have today is similar to what Richard was talking about. A lot of people, experts, healthcare specialists, even police, law professionals. So a lot of actors already support decriminalization, and they understand and speak for the change. And even that doesn't change the opinions of the politicians. And the main reason why is that politicians look at their voters. So for many years, advocates and experts have been trying to influence the decision makers and to explain things to them, forgetting about the general population. And in some, perhaps in many cases, working with the general population is even more important, because politicians, I would say more often than less, understand the benefits of decriminalization, but they represent their voters. And if their voters don't understand the benefits, the politicians will do what they are supposed to do, what their voters expect from them. So I would say that two things are very important. That is to fund the work with general population and to focus more on the work there, not only on influencing the decision makers. And also the United Nations leadership on decriminalization is very, very important. The joint statement is important for advocacy on all levels, but a clearer statement would be useful, because when things turn political, decriminalization often turns into an issue of cannabis use, because it's politically easier to reach this goal. It's more popular among general population and easily understood. But we know that drug policy changed, the shift from punitive policies to actually healthcare and harm reduction and helping people and really solving the issues related to drug use. This perspective is really not understood on the political level, or not understood well. And clear United Nations statement with more explanation that actually decriminalization is a lot about vulnerable populations and not so much about cannabis use, we could say, is very, very important for all the politicians who work to push forward this agenda, who work to explain to the general population, their voters, and to raise the discussion on the political level, so that more media attention is attracted and we can educate people working all together for this specific change. So thank you very much again for inviting me to speak.
Thank you so much, Morgana. And it's great to have someone that works on the political side here to kind of talk about that experience and the messaging around criminalization. Very interesting. And thank you for the work that you're doing in Lithuania. So second to last speaker we have is Ernesto Cortez. Ernesto is Secretario of the Latin American Network of People Who Use Drugs and has been involved in drug user advocacy in Costa Rica and Latin America for over a decade. Ernesto will be discussing how the criminalization of drugs has caused human rights violations against people who use drugs in his region. So Ernesto, whenever you're ready, please take it away.
Thanks, Jake, and thanks everyone else for this opportunity to be here. Thanks also to all the presenters, excellent presentations, Fariba, Judy, Ludo, Richard, Morgana, and everyone else that is here. Okay, so hello everyone. Good morning, afternoon, evening, wherever you are in the world. My name is Ernesto Cortez. I'm from Costa Rica in Central America, and I've been a member of the Latin American Network of People Who Use Drugs since 2014, I think. So first of all, I think it's important to acknowledge that Latin America and the Caribbean has a long history of drug use, full of cultural traditions, or for many different plants, mushrooms, cactus. Many of these traditions still exist, even though colonialism, and the war on drugs have reduced and scattered and stigmatized most of these behaviors, and traditions. But also for the last decades, our region has become the center of the war on drugs. It's also one of the most unequal and violent regions in the whole world. And stigma and criminalization and human rights violations towards drug users have become almost a standard of this war on drugs. The biggest contradiction I can say is that most of all Latin American drug laws, in most of Latin American drug laws, substance use and drug dependence is considered a health issue, not a criminal issue, even though drug possession of even small amounts of any kind of substance is harshly penalized, and drug selling, low-level drug selling, is disproportionately punished, carrying many years in prison. For example, the minimum sentence for drug trafficking in Colombia is 10 years, and here in Costa Rica it's 8 years. But we could say, and we said because we had some conversations, internal conversations in INPUD last month, that the biggest risks and the biggest harms we have as drug users is with police. Myself, I can say that I lost count how many times I've been stopped, frisked, and detained by police since I was a teenager, even though that in Costa Rica, drug possession is decriminalized for at least 20 years. You can see that in the last INPUD decriminalization report. But police harassment and violence towards drug users, it's a common practice in Latin America. And depending on the country, it also may lead to arbitrary detention and imprisonment for just carrying small amounts of drugs for personal use. In fact, many of us in INPUD have been in prison or have families or friends incarcerated for low-level drug offenses. And the other side, there are almost no integral healthcare policies to address drug use, and harm reduction interventions are almost inexistent or unknown in many countries. Compulsory treatment is also a problem, and it's really common in the region. It is usually done by regular organizations that are not supervised by government, because many governments don't even have a policy on how many of these centers should work. Many of them don't apply evidence-based programs, don't have basic sanitary conditions. Religious indoctrination, it's a common practice, and violence is considered therapy. For example, a couple of years ago, 18 young men died in a fire in a rehabilitation center in Ecuador because they were locked in and couldn't get out. And also in Mexico and Guatemala, you could see a lot of cases of torture and sexual violence that have been reported, but nothing has been done. And this is even worse for women, because besides physical or psychological violence, they may also experience sexual violence from police or by the personnel of these treatment facilities. Also, if a woman uses drugs, they may also lose their access to social services like housing, money subsidies, job opportunities, psychological support. And if they are also a mother, they could lose custody of their children without any other help or support from the government beside punishment. Other human rights violations can be found in the education sector. It systematically expels students for using or carrying small amount of drugs without giving them any health or social alternative. Or in working place, because in many countries in Latin America, criminal records are asked to hire a person for a job. And we can even go to talk about prisons, for example, in where there's almost no prevention or treatment programs, but there are a lot of punishment for drug use possession that could carry solitary confinement or longer prison sentences. So there's no doubt that stigma and criminalizations are the biggest problems we face as drug users, because these issues don't only break our bodies and our minds, it also affects us in many different ways and limits our rights and freedoms like liberty, non-discrimination, equality, health, education, family, due process, and I can keep going, and repeat as many things that has been said already in this webinar. Side event, sorry. So when we focus on the HIV response, for example, criminalization and stigma clearly affects on how drug users access to prevention and treatment, as many drug users will avoid to use health facilities because of the fear of being arrested, humiliated, or at least mistreated. In some countries in Latin America, in Bolivia, for example, antiretroviral medication might be denied if you don't stop using drugs. And even though there's no reference to treatment facilities or rehabilitation sentences, not even thinking about harm reduction. In fact, harm reduction in Latin America hasn't been funded, almost never, for a few countries like Colombia or Brazil, Mexico, or Dominican Republic. And this is mainly because harm reduction in this focuses mainly on injecting drug users. And injection is not a common practice in Latin America. So we almost don't see any harm reduction in the region. This has also limited our participation in the construction and implementation of public policies, as we are not even considered key population at the Global Fund country recipients, and we're not part of any country coordination mechanisms yet. This also ignores how our community intersects with other key populations. In fact, drug use prevalence is much higher among trans women, sex worker, MSM than in general population. But this is not being addressed. In fact, it increases criminalization to this already stigmatized population. That's why we could say harm reduction in Latin America is focused more on people than the substance, on recognizing vulnerability, diversity, and autonomy than in reducing HIV transmission or overdose. I can say it's more a political stance than a health or social intervention. And that's why we as a community, a social movement, make a strong call for decriminalization of drug use and drug possession, but also a call to recognize the failure of drug policy in Latin America and the need to make an urgent and quick change. I could say not all are bad news. Since 2019, INPUD has been included as part of a multi-state grant from the Global Fund for the first time ever. This has given us the opportunity to show and prove that we are not the problem, that we are part of the solution. Also to push forward public health policies that are inclusive, accessible to all, based on scientific evidence, and that respect and guarantee human rights. These are basic concepts, not only for an integral response to drug use, but also for the HIV response, mainly if we want to obtain international objectives like 90-90-90 or the Sustainable Development Goals. We could think decriminalization as a stepping stone process on a public policy that finally recognizes human rights of people who use drugs, in which policing is out of the question, where there's access to so many different health and social services, with a greater involvement of participation of people who use drugs, and also to start discussing and thinking on how to legally regulate drugs and have a safe access for us people who use drugs. Thanks for this opportunity and hope change will come. Thank you very much.
Absolutely wonderful, Ernesto. Thank you for being here and for giving such a strong statement calling for the involvement of people who use drugs in this process. I thought what you just said about we are not the problem, we are part of the solution really summed it up quite easy and well. Thank you. So we have one more speaker here, and I know that we are running short on time, so I hope people can stick around for just one more final presentation because it's a great one, as they all have been. Our final speaker is Zaved Mahmoud, a human rights and policy advisor with the Office of the High Commissioner on Human Rights. Zaved will be expanding on the human rights situation for people who use drugs. And at the end of his presentation, we'll be showing a short video by the OHCHR on decriminalization. So Zaved, whenever you're ready, please take it away.
Thank you very much. Thank you, Jake. And also, I would like to thank the INPUD for organizing this side event and inviting OHCHR to speak at this event. At the outset, I would like to welcome the recent milestone report of INPUD on decriminalization. Congratulations to all who were engaged in preparing this report. Dear colleagues, over a year into the COVID-19 crisis, countries across the globe continue to face alarming level of pressure on health and social services. In his policy brief on human rights and COVID-19, Secretary General Antonio Guterres recognized the devastating impact of the COVID on the most vulnerable and marginalized individuals and communities, including on people who use drugs. Thousands of people who use drugs and with the drug disorder have been adversely affected in the enjoyment of their rights, human rights, in particular in accessing vital and life-saving healthcare and harm reduction programs as health system has engulfed by the pandemic. Despite long recognition of harm reduction measures as essential element in the protection of right to health of the people who use drugs, international community are further away from meeting the needs of people who use drugs than ever before. Recent report of the Harm Reduction International provides evidence that in addition to administrative and legal barrier in many countries, the limited funding is causing serious obstacle in providing harm reduction services. Funding is just 5% of the $2.7 billion that UNAIDS estimates is needed annually by 2025 for an effective response. This dire situation must be addressed immediately. Colleagues, the COVID-19 pandemic occurs in the context of a long-standing general crisis of the global prison situation. Previous speaker highlighted this issue. 20% of the current 11 million prison population are detained for drug-related offenses, including around 500,000 people for simple drug use. The punitive drug policy have been significant driver of over-incarceration in many countries. The infection rate of a disease in overly crowded prisons would be always higher than among general population. People with substance use disorder, HIV, hepatitis, TB in prison and other closed settings would be at risk of COVID-19, we knew that. At the early stage of the pandemic in March 2020, WHO and OHCHR jointly issued a guidance on COVID-19 and person deprived of liberty, which included recommendation of measures aiming to protect people who use drugs in closed setting also. Unfortunately, as of the last month, around 550,000 people in prison in 122 countries have tested positive for COVID-19. Regrettably, around 4,000 have died from it. Despite clear commitment of these states to reduce female prison population, as mentioned by some colleagues in a few minutes before, we have noticed an increase of over 100,000 female prison population in the last decade only, making total female prison population around 740,000 globally at this moment. In several countries, such increase occurred due to the punitive drug policies. Dear colleagues, Recent events of Black Lives Matter movements have made it impossible to ignore the very frequent and often systematic presence of racial bias in policing and justice institutions, including those that are engaged in the drug enforcement around the world. People of African descent are more likely to be arrested for drug possession, despite equal level of use in comparison among different social groups, and subjected to harsher treatment and sentences. These issues are not restricted to one country, one region, or one community. UN Working Group on Experts of People of African Descent view that the war on drugs has operated more effectively as a system of racial control than as a mechanism for combating the use and trafficking of narcotics. Countries must redress racial discrimination in drug law enforcement. Another critical issue that deserves much needed attention is the impact of drug policy on LGBTQ plus community. Judy and other colleagues mentioned this issue. In June each year, we observe the Pride Month, celebrating LGBTQ plus right movements and their achievement. There have been many achievements, but more needed. In its report entitled What We Have Learned Over the Last 10 Years, the UN Task Team on Drug-Related Matters noted that, I quote, LGBT persons who use drugs are disproportionately impacted by drug policy in many countries and experience a range of harms. LGBTI people who use drugs may not seek support or treatment from healthcare providers because of previous and anticipated experience of discrimination. LGBTQ plus substance use must be understood within the context of stigma, prejudice, discrimination to which such people are already constantly exposed to. There is an urgent need for more research and specialized program for LGBTQ plus people who use drugs. Colleagues, let me reflect on some UN policy which clearly articulate the importance of protection of human rights of people who use drugs and recommended various directions for action to this end. Colleague already mentioned the UN system common position on drug-related matters, as well as the UN system common position on the incarceration. But let me highlight one aspect from the last document, UN System Common Position on Incarceration. This common position, which is adopted last May, the common position includes several actions aiming to reduce the impact of the drug policy and prison system, including promoting the alternative to imprisonment for minor offenses and decriminalization of drug use. I will share the link of this document shortly in the chat. Let me also highlight the importance of the international guidelines on human rights and drug policy, which already my colleague from UNDP has discussed and elaborated. I would like to mention one thing, that we have already seen the positive impact of the guideline also at the national level. For example, Constitutional Court in Colombia has cited the guideline twice in 2019 in a decision regarding substance use, personal use of drugs, and human rights, and also last year in a landmark case on crop eradication. We must continue promoting and disseminating the guidelines at the global, regional, and national level. Colleagues, at the end, I would like to bring to your attention a study on arbitrary detention and drug policy just issued by the UN Working Group on Arbitrary Detention in the last week. Let me highlight some recommendations of the working group which are most relevant for our today's discussion. In its study, the working group recommended states which we have discussed. First recommendation has been the decriminalization of the use, possession, acquisition, and cultivation of drugs for personal use. The working group also recommended that to ensure positive and evidence-based messaging. Already, our colleague from Lithuania highlighted that the messaging is important. This positive evidence-based messaging through media and publicly accessible resources, which may assist in reducing stigmatization and promote better understanding of the health and other benefits of decriminalization. Working group also recommended promptly release a person detained only for drug use or possession for personal use and review their conviction with a view to expunging their records. They also recommended close without delay state-run compulsory detention center and private treatment facilities and immediately release person confined against their will in such facilities. Ensure that neither drug courts nor the regular courts use the threat of imprisonment as a means to coercively influence an accused or convicted person into drug treatment. The use of drug courts should be discontinued. The working group recommended. They also recommended forced drug treatment should never be ordered by the courts. They also recommended they ensure that military authorities are not in principle involved in drug enforcement activities and have no role in the management of drug treatment facilities. And among another aspect they highlighted, which I would like to also highlight, that they asked or recommended states to protect the rights of indigenous people to produce crops and plants that they have traditionally grown for their religion, for their religious, medical, and customary purposes. These are some highlights of the report. I will provide the link on the study in the chat room. Encouraged to look at it. I encourage all participants to look at it. At the end, again, I would like to highlight the importance of the decriminalization of drug use. Office of the High Commissioner for Human Rights fully support this call. And in few seconds, we are going to screen a short film. And with that, I would like to end my remarks. Over to Jack. Thank you.
Wonderful. Thank you so much, Saved, and very powerful presentation. So now we're going to just watch the short video by OHCHR.
My first taste of drug is when I'm 15. I involved with drugs problematically for 20 years. I was sentenced to prison for 2 times for a small possession of heroin during that time, and 2 times to rehab center. And actually it doesn't stop me from using, as I'm currently using.
The so-called war on drugs is driven by the idea that crackdown on people who use drugs or who are involved in the drug trade, the drug problem will go away. 20% of the prison population now in detention for drug-related offenses, including for personal use of drugs.
People who use drugs do not forfeit their human rights by virtue of their drug use. And that in parallel, we ensure that their other rights are met as well, in particular, the right to the highest attainable standard of health.
We are witnessing, in some cases, increasing human rights violation related to the drug control efforts. This includes extrajudicial killings.
The fear of criminalization, of arrest, and of punishment acts as a huge structural barrier that drives people away from seeking health and harm reduction services, such as HIV prevention services, needle and syringe programs, for example, and has led to an epidemic of HIV amongst people who inject drugs globally.
with the criminal record that I hold as a prisoner for a small possession of heroin at that time. There's no way that I can do even e-hailing job. I cannot do Grab, or I cannot help others.
We are asking state to change to move from the punitive approach. Policy changes could also help the criminal justice system to take away the pressure from them only for this crime.
Wonderful. Thank you so much, Zaved, for that video and the wonderful presentation you gave. Really appreciate the comments, as people know in the chat, about noting the war on drugs and criminalization of drugs as a method of social control. I think that's a very important point to highlight, especially in the human rights context. So we have run out of time for this event, and I don't want to keep people for much longer, as I know we have other things to go to. So unfortunately, I don't think we will have time to take any questions today. I'm very sorry about that, but we will be sending the presentations of all participants to everyone afterwards, along with materials that were mentioned during this side event. Just want to give a few closing remarks before we wrap it up here. I just want to thank everyone again for your participation, and to our incredible speakers for leading this discussion on human rights among people who use drugs. We hope this has been an informative session to highlight the current human rights and health barriers faced by people who use drugs, and also convey the urgency and necessity of policy initiatives to reform laws upholding the criminalization of drugs and the people who use them. It is past time to firmly refute the idea that using drugs justifies punishment and intervention into the lives of people, and recognize that continuing to criminalize drug use drives the very human rights barriers we have discussed today. People who have drugs have been advocating for decriminalization for decades, and the results of this work are beginning to bear fruit around the world. More states have moved to depenalize or decriminalize drug use. The UN Common Position calls for a decriminalization of drug use, and the new global AIDS strategy includes targets and ending the criminalization of key populations, including people who use drugs. So the time to act is now. Decriminalization is a necessary step towards fulfilling human rights obligations, achieving racial equity, and ensuring a strong global HIV response. Noting this, we call on all member states, UN agencies, and international stakeholders to devote the time, political will, and resources needed to fully decriminalize drugs, and to work closely in partnership with peers and drug user advocacy networks in the development and implementation of decriminalization policies. So thank you again to everyone for joining us today. A recording of this event will be made available later in the week, and INPUD is happy to address any follow-up questions you may have if you reach out to us. So thanks, and everyone have a great rest of your day.
Thank you.
Thank you so much. Amazing. Thank you, INPUD. Thank you, presenters.
Thank you, Ilya. Appreciate you being here.
Inspire us. Thank you.